I promise you that today I will not only debunk myths that have haunted you for decades, but I will also reveal 10 hidden risks that almost nobody mentions, and that could be affecting your vitality, your ability to connect with other people, and ultimately your sexual and emotional health. Imagine for a moment that while you thought you were freeing yourself from stress and tension, you were actually feeding a cycle of loneliness, physical wear, and disconnection from your own body. Does that sound exaggerated? Believe me, it's not. I am the doctor, and today I want to talk to you directly about something I consider fundamental for your well-being: masturbation in men over 60 years old. It is neither a dirty vice nor a panacea without consequences. It is a natural practice that, if not done with knowledge and awareness, can become a silent trap. I want you to listen carefully to each of these 10 risks that I am going to share. At the end, I will give you very concrete recommendations so you can continue enjoying your sexuality in a healthy, full, and guilt-free way. Let's start with the first of these risks: social isolation. Maybe you haven't noticed because it happens very quietly. Many men reach an age when social life shrinks, friendships drift apart, family responsibilities change, and little by little, masturbation begins to take a central place. I'm not talking about a one-time act to relieve tension, but a habit that replaces human connection. Every time you turn to it to fill an emotional void, you are actually reinforcing loneliness. This kind of isolation not only impoverishes your emotional life, it also has direct consequences on your mental health, increasing the risk of depression, anxiety, and even cognitive decline. The second risk is less visible, but just as important: microskin injuries. As the years go by, the skin of the penis becomes thinner and less elastic. Masturbation performed with harsh movements without adequate lubricant can cause small cracks, persistent irritation, and in some cases, local infections that take a long time to heal. You may feel itching or burning, or simply notice a slight discomfort that you get used to ignoring. But those repeated small wounds are cumulative. The third risk is progressive desensitization. If you have been using the same stimulation pattern for years, exactly the same gestures, the same pressure, and the same fantasy, your nervous system gets used to it. It's as if your brain stops registering the novelty and the natural excitement that comes from contact with another person. This translates into difficulties achieving a satisfactory erection with a partner or enjoying real sexual intercourse because your body is conditioned to respond only to a very specific stimulus. The fourth risk may surprise you: masking erectile dysfunction. Some men achieve an erection during masturbation because they are completely relaxed, without the pressure to please another person. However, when the time comes to share intimacy with their partner, the erection does not appear. This contrast can confuse and delay the diagnosis of vascular, neurological, or metabolic problems that require medical attention. Ignoring this symptom out of shame can mean losing the chance to improve your overall health. The fifth risk is nerve compression due to bad posture. Have you noticed how you position yourself? Many men sit on the edge of a chair or adopt slouched positions that compress the pudendal nerve, which is key for the sensitivity of the perineal area and erectile function. When this compression is repetitive, it can cause decreased sensitivity, tingling, numbness, and in the long term, sexual dysfunction that does not resolve just by stopping masturbation. The sixth risk is using masturbation as the only emotional outlet. This is one of the most delicate aspects. Sometimes, instead of expressing emotions like sadness, fear, or frustration, all these feelings are channeled through the momentary relief of masturbation. The problem is that over time, this becomes an avoidance mechanism. Internal conflicts are not faced, nor are healthier ways of managing discomfort sought. Masturbation ceases to be a conscious choice and becomes a crutch that distances you from your own personal and relational growth. The seventh risk is guilt and shame. You may yourself have grown up with contradictory messages: that masturbation is sinful, that it degrades you as a man, that it is a sign of weakness. Although rationally you understand that it is a natural practice, those deep-rooted beliefs continue to generate guilt. And sustained guilt damages self-esteem, worsens mood, and can lead to a profound rejection of your own sexuality. The eighth risk is pelvic congestion. Some men believe that the more frequently they masturbate, the healthier their prostate or sexual potency will be. The reality is that if a minimum recovery time between ejaculations is not respected, an increase in pressure in the pelvic area occurs, which manifests as heaviness, diffuse pain, or fatigue. If this happens repeatedly, it can even affect the pelvic floor and increase the risk of urinary incontinence. The ninth risk is the impact on semen quality. Although it may surprise many people, ejaculating excessively reduces temporarily the concentration and mobility of sperm. If at your age you are considering the possibility of conceiving, it is important to know that seminal quality takes several days to recover. It is not about demonizing masturbation, but about understanding that every excess has a price. And the 10th risk is disconnection from reality. The proliferation of hyperstimulating pornographic content makes many people over 60 get used to unrealistic fantasies that ultimately reduce interest and the ability to enjoy authentic intimacy. It is increasingly common for men in this age group to need more and more extreme stimuli to get excited, losing the ability to feel pleasure from caresses, glances, or the complicity of a real partner. Now that you know these 10 risks, I want to ask you a question. Do you really think you can afford to keep ignoring the impact this practice has on your health? I don't think so. That's why I want to share with you a natural, simple, and safe method so you can enjoy your sexuality without guilt or risks. Before detailing it, I want you to reflect for a moment. When was the last time you consciously paid attention to your body during masturbation? Have you explored new ways to stimulate yourself without relying on external images? Have you allowed yourself to feel without rushing, without the pressure to reach immediate orgasm? I invite you to start here. Dedicate a few minutes to reconnect with your body. Observe your breathing. Become aware of the posture you adopt. Choose an adequate lubricant, and give yourself permission to explore new sensations. Introducing variety and stimulation is one of the best ways to avoid desensitization and keep your response capacity alive. If you notice that you use masturbation as a constant emotional refuge, look for other tools: meditation, writing, therapy, or physical activity. Remember that sexual health is inseparable from emotional health. Don't be afraid to ask for help if you feel that guilt or shame are conditioning your well-being. I want to emphasize something fundamental. Masturbation is neither good nor bad in itself. It is a tool. Like any tool, its effect depends on how it is used. It can be a path to self-knowledge, a resource to relieve tension, or, on the contrary, a door to dependency, dissatisfaction, and isolation. If you have made it this far, you already have the information necessary to make conscious decisions. Don't let routine and misinformation steal your right to live your sexuality healthily. Dare to question habits, try new practices, and speak openly about your needs. And if you want to delve deeper into this topic, in upcoming videos I will tell you specific strategies to strengthen the pelvic floor, improve blood circulation, and recover sexual vitality, even if you think your time has passed. That's not true. Sexual fulfillment is not the exclusive domain of the young. It is within your reach if you decide to care for yourself with respect, attention, and responsibility. Remember, your sexual health is a reflection of your overall health. Don't relegate it to a dark corner of your life. Put it at the center, observe it with curiosity, and treat it with the dignity it deserves. If this content has been revealing to you, share it with others who might need it. See you very soon, and don't forget that awareness is always the first step to transform your well-being.